an improvement of about 25 months.
Seeing the HER2CLIMB-05 data, tell me your thoughts on that, Mabel. When you saw the addition of tucatinib to maintenance, what did they find?
So obviously this is post induction with your Cleopatra regimen. That's important to know. And they did take both the ER positive and the ER positive group of patients and randomized them to receive TRAS-based therapy with or without tucatinib. And what they saw in their first analyses is an improvement of about 25 months with the tucatinib arm versus roughly around 16 months. But when you looked at the ER positive and the ER negative group, there was a slightly higher numerical benefit for the ER negative group, a delta of about 12 months, as opposed to nearly 7 months in the ER positive group.
And my understanding is not all the ER-positive patients got endocrine therapy.
That is correct, about half.
About half. So sort of factoring that into, and speaking of PATINA, also a really good progression-free survival on the PATINA. And can you talk us through the PATINA trial a little bit?
So I think that also is something that we have to, when we're talking about individualizing therapy, is certainly one of the things that Mabel mentioned is looking at the degree of hormone positivity. Is this a patient that has high expression of estrogen receptor, progesterone receptor, and even clinically is behaving a little bit more like a luminal cancer, right? Do they have limited bone metastasis, long disease-free interval, limited burden of disease, lack of visceral disease, lack of brain mets? If it's that type of a patient, then PATINA might be a really good strategy. So in PATINA, they randomize patients after a Cleopatra-like induction standard of care to have the addition of palbociclib at the standard approved dose, 3 weeks on, 1 week off, as kind of a maintenance strategy, or placebo. And they saw that the patients that received the palbociclib actually had quite durable responses. I've spoken with Dr. Rugo about this. She was one of the main investigators, and she says she has patients still on, that are doing very, very well. So for those patients with hormone receptor positive disease, that can be a very viable strategy. We all know how well palbo is tolerated. The monitoring is relatively easy. And so that might be a good option for those patients that we feel like are more of a luminal type of a phenotype.